Let's face it, it's hard to be emotionally healthy when you're going through cancer diagnosis and treatment. It's normal to feel lots of different emotions: fear, anger, sadness, frustration, resentment, and even sometimes relief or gratitude when we get a piece of good news. Many people find that they have a sense of, this isn't real, or this can't really be happening. As the cancer treatment wears on, and it's usually longer than anyone expects, you might find yourself thinking, I don't think I'm coping well with this. First of all, please remind yourself that you are going through a very hard situation. Like a flood on your house foundation, cancer diagnosis and treatment have a way of finding all the cracks in our lives and relationships and making them larger. If you were someone who tended to worry, had a hard time asking for help, or had difficulty sleeping before cancer, these things may be worse now. When you really think about it, can you imagine anyone going through your situation without some emotional distress? So remind yourself, and others if need be, that it's okay to not be okay. That said, it can be helpful to know some things that might help you weather the storm with a little less pain. First, you may want to figure out what you can control and do that. Is it what you're eating or seeking information? Or it could be making choices about how you spend your time and energy or asking for help. You may want to find support. As Mr. Rogers taught us, anything that is mentionable can be more manageable. When we can talk about our feelings, they become less overwhelming, less upsetting, and less scary. Talking to others is a powerful way to help us cope. Sometimes it's tempting to hide from our fears by not talking about them, but in the long run, most people feel better when they talk about their fears. If I had a nickel for every time a patient said to me, I thought talking about my cancer would make me feel worse, but I actually feel better, well, I would have a lot of nickels. Remind yourself, what has helped you before? Are you someone who does well with talking to others? Or does it help to distract yourself? Does music, being outdoors, lift your spirits? It's also good to recognize common thought traps, like thinking you're a burden, or thinking you will always feel the way you do now, or even thinking I must have done something to deserve this. These thoughts are common, but they're not true. Guided meditation can be helpful. There's a video in this series about how to calm down your body and mind. It often helps people to write. Keeping a journal or writing letters, even ones you don't send, can be a powerful way to express and understand your emotions. I also encourage you to be kind to yourself. Accept that you're human. It's human to have emotional reactions to cancer. This one is so important that we've devoted a whole video to it. Unfortunately, for most of us, our instinct is to get frustrated or upset with ourselves when we can't do what we're used to doing. That frustration with ourselves makes things worse, so try to be kind to yourself through this process. Also, there is help. Talking with a therapist, meeting with a support group, or even just reading suggestions about coping with cancer can be helpful. It can help to know that you are not alone and give you new ideas about things to try. Talking can also help you sort out your thoughts and feelings. We have therapists like me at Tennessee Oncology. If you would like to see one of us, just ask your oncologist. You can meet with one of us at a clinic or by telemedicine. With telemedicine, all you need is a phone. Your health insurance can also give you a list of therapists, and you may have an employee assistance plan, often called an EAP, that lets you see someone with no copay. There are several good support groups that meet locally in person, as well as ones that meet online. Check the resources page for contact information for these. For those who might not like being in a group, there are also ways to get one-on-one peer support. If you contact them, they match you with a cancer survivor who has been trained to be a peer supporter.